Good evening to one and all present here. Switch India is a pan-India healthcare organization of 1,500 and more medical professionals all across 6 states like Maharashtra, Gujarat, Tamil Nadu, Andhra Pradesh, Rajasthan and Karnataka, working on various social activities including checkup camps, working on physical and mental health, spreading awareness on various medical conditions and so forth. Myself, Prithvi Parekh, a medical personnel from Mumbai, co-head of Awareness Cell at Switch India and in charge of organizing this webinar today, along with my co-head Deep Sagar Kundu from Chennai. On behalf of this NGO, we have Sweta Muthu and Cheryl Chettiar, who are healthcare personnel having experience with health education on various medical topics. As you all may know, the first week of August is celebrated worldwide as Breastfeeding Awareness Week. On this occasion, we have arranged this webinar for pregnant women and women who have delivered recently. We also have some medical students attending today's session. We welcome you all. A request to all the medical students to direct their medically relevant questions to me, that's Trupti, on WhatsApp. Your questions will be answered separately so as to not create any confusion for other participants here. I'll be sharing my WhatsApp number in the chat box in some time. I would request all the participants to kindly keep your mics muted so that there are no external disturbances while the speakers are presenting their talk. In case of any doubts or questions, you can put them up in the chat box and our presenters will be addressing them towards the end of the session. Over to you, Cheryl and Shweta.
Good evening everyone, my name is Shweta and I am from Chennai. I'll be presenting this webinar along with Cheryl.
Good evening everyone, I'm Cheryl Chettiar and I would like to extend a very warm welcome to all the strong, powerful, passionate and absolutely beautiful women and their family members who are present with us today for this webinar on breastfeeding awareness. I'm so glad that you could all take time from your schedules and attend this webinar along with us, wherein we're going to have an interactive session. We're going to share our thoughts and ideas. We're going to support each other. We're going to empower each other. And of course, we're also going to fill our bags with a lot of knowledge and a few really important facts. So before we begin with our actual presentation, I would like to engage all of you all into a really tiny and a quick activity. So the name of the activity is the gratitude list. Alright. So I expect you all to have 4 options on your screen, and all that I want you to do is have a small piece of paper and a pen along with you, and if that's not possible, you can also write down your answers in the chat box. So what is the activity about? You have 4 options and you have to arrange the options according to a rank, according to which you are most grateful for towards each option. So for example, your option number 1 will be the option for which you show the utmost gratefulness, for which you are most thankful for. Okay, so I'm going to give you all a minute over here to introspect yourself and think about yourself for being a woman, or else think about your baby, for your family, and also think about your ultimate creator, that is your God. So I'm giving you a minute here, and please jot down your ranking order. Are there any questions? I just hope everyone is engaged in the activity. Okay, all right. I expect most of you all to have been done by now. Can I get a heads up? Or, actually, I would really like if a few of you all could unmute yourselves and volunteer to share your ranking order and also give us a little insight on why did you rank the way you ranked. So, can we please have a few enthusiastic ladies unmute themselves?
मी कॅन्सल करू काय मला काही समजत पण नाही आहे.
Yes, please. Can we please have a few ladies volunteer and give us their ranking order? We would really like to know your ranking order and just a short insight on the reasons why you've ranked.
Hello.
Yes.
Cheryl, can you hear me?
Yes, I can hear you.
Yeah. A very good evening to you. My name is Krupa, and I am not a woman or some. I mean, I am a student studying physiotherapy. So I have
Okay.
just joined this seminar to be aware. My ranking list for showing gratitude would be first for God, because first I am very spiritual that way. I mean, I believe that God is always with me, like He helps me in everything, and so first would be God, then my family, because they are the first ones to, obviously they are the first ones to support in everything that I do. So yeah, and for after that, maybe I'd consider ranking for being a woman. Like I'd be not, I don't have any special reason, but yeah, I'm happy that I'm a woman. That I would be able to produce something so precious in this world. Matlab, I could contribute something so precious in this world, a whole child, a future to this world. So yeah, that is my gratitude list. Correct.
Thank you so much, Krupa. I think that was really very beautiful. I really love the way you explained, and it totally justifies your thoughts. Thank you so much. Can we have somebody else also go for a try? We would really love to see more people give us their ranking order. Anybody else? Okay, can I please have somebody else volunteer, or shall we move ahead? I hope all of you are done with your ranking. All right. I think Krupa was the only one who volunteered to share with us her ranking order. Nevertheless, I hope all of the women have done their ranking and introspected themselves for a minute. And I hope you like the activity. But before moving on, I would like to tell you just one thing, that all rankings are absolutely just perfect. If you have decided to put yourself first, there is absolutely nothing wrong in prioritizing yourself, in showing some self-love for yourself. If there might be a few ladies who must have had all of their options equal, and that is again not at all a problem. It totally depends on you. It's your choice. All that you have to take care is to work efficiently towards your priorities and have a really very balanced life. And at the end of the day, all that you should know for yourself is being happy with yourself and also with the people around you. All right. Thank you so much for engaging in this activity, all of you all. I would now like to ask Shweta to take over.
Okay, good evening everyone. This is Shweta again. And as Tripti had introduced in the beginning, August 1 to 8 is celebrated as World Breastfeeding Week. The theme of this year's World Breastfeeding Week is Support Breastfeeding for a Healthier Planet. Although we all know that breastfeeding is the ideal form of infant feeding that is crucial for lifelong health and well-being, It provides your child with the best possible start to life. But despite this, often infant feeding practices are not exactly optimum. This could be due to various causes, such as lack of updated knowledge and training among medical and paramedical personnel, misconceptions in society, misinformation spread by infant food manufacturers, and lack of community and family support to women. Therefore, we have arranged this webinar at Switch India on account of Breastfeeding Week in order to help new or expecting mothers in their journey. Today we will be covering the following topics: composition of breast milk, the recommended duration of breastfeeding, methods of breastfeeding, COVID-19 and breastfeeding, medical considerations, benefits for the baby as well as the mother, social stigma attached to breastfeeding, and at the end of the session we'll have a fun myth-busting session. Let's first start off with composition of breast milk. What exactly are you feeding your infant? Okay, sorry. Mature human breast milk is made of approximately 1% protein, 4% fat, 7% carbohydrates, which is mainly lactose, 0.2% minerals, and the remaining 87% is just water. However, in colostrum, which is the milk secreted in the first few days after childbirth, the protein content is significantly higher and carbohydrate content is lower than in mature milk. Also, you may notice that your milk seems thicker and creamier towards the end of the feed. This is because, as the feed progresses, the fat composition gradually increases. It's often referred to as hind milk, and the first more watery milk is known as foremilk. Now let's talk about colostrum. Colostrum, also known as liquid gold, is a thick, yellowish and scant fluid secreted during the first few days after childbirth. It is a vital blend of essential nutrients and antibodies that help develop your baby's immunity. It also protects her against allergies and digestive upset. It stimulates her first digestive movement and protects against jaundice. One common worry that a lot of new mothers have is that their colostrum is too less, that is, the amount is too less. However, do not worry about it. Whatever amount is secreted, it is the right amount for your newborn baby. As the baby grows, so will the amount of breast milk that you secrete. Recommended duration of breastfeeding. Prominent health authorities suggest that breastfeeding should be initiated as soon as possible after birth. Half an hour or a maximum of 1 hour after birth in case it's a normal delivery, and up to 4 hours after birth in case of cesarean section. Be very careful to make sure that it is the first thing that is fed to your baby. The baby should be exclusively given breast milk for the first 6 months, and I cannot emphasize this enough. You shouldn't give your baby anything else, not even water. Also, the baby should be fed on demand, that is, whenever the baby gives any indication of being hungry. This is known as demand feeding. After 6 months of exclusive breastfeeding, you can add some complementary food. This can be continued up to 2 years or even beyond, as long as the mother and baby both desire it. Now let's look at some of the methods of breastfeeding. First, I'll explain what is the general method to start breastfeeding, and then we'll look at some of the different holds, such as cradle hold, football hold, and so on. So first, begin with holding your baby by facing your breast, with the front of her body facing yours, tummy to tummy. Her head should be in line with the rest of her body, and it should not be turned to the side. This is in order to ensure that her swallowing is easy. Next, start by tickling your baby's lip with your nipple to encourage your baby to open her mouth very wide like a yawn. If your baby isn't opening up, then try to squeeze a little bit of colostrum and after that a little bit of milk onto her lips. If your baby turns away while you're doing all of this, don't worry, just gently stroke the cheek on the side nearest you. This is called as the rooting reflex, and it will make your baby turn her head towards your breast. Next, bring the baby forward towards your breast once her mouth is open. Make sure that you don't lean over and push your breast into the baby's mouth. You should let your baby take the initiative. So keep a hold of your breast until the baby has a firm grasp and is suckling well. You'll know you've got a proper latch when the baby's chin and the tip of her nose are touching your breast. Her lips will be flared outward like a fish. Check to make sure that she isn't sucking on her own lower lip or tongue, because honestly, babies will suck on anything. You can check this by pulling down her lower lip while nursing. Next, you should watch to make sure that your baby is suckling, that is, extracting milk from your breast, and not just sucking on your nipple. If the baby is suckling, you'll see a strong, steady suck, swallow, and breathe pattern. You'll also notice a rhythmic motion in the baby's cheek, jaw, and ear. Once your milk comes in, listen for the sound of swallowing or gulping. You'll know the baby isn't latched properly if you hear some sort of clicking noises. A typical breastfeeding session will generally last around 20 to 30 minutes, but please do keep in mind that this is just an average number, and in honesty, your baby can take any amount of time to feed as long as you are both comfortable. It will also take more time to feed in the beginning or during growth spurts. Another important point is, while you're breastfeeding, make sure that you drain one breast fully before moving on to the next breast. This is to ensure that your baby gets hind milk. Remember in the beginning of the presentation, I had mentioned hind milk, which is very rich in carbohydrates. So in order to make sure that your baby gets this hind milk, you have to make sure that you drain one breast fully before starting the next one. So if your baby has drained one breast, then offer the next one, but don't force it. And if your baby doesn't want it, then during the next feeding, you can start with the next breast. I had mentioned in the beginning that it is good for you to practice demand feeding. That is, feeding your baby whenever she seems hungry, instead of sticking to a fixed schedule. But how do you know that your baby is hungry? Usually people think that you should wait until the baby cries in order to know that it's hungry. But at this point of time, if your baby is crying, that must mean she's already very uncomfortably hungry. So she will give some signs and indications much before she starts crying, which show that she's hungry. These are nuzzling against your breast, suckling on her hand or anything else actually, opening her mouth wide, the rooting reflex, sucking on her own lip or tongue, smacking her lips, or in the end crying. Now let's see how to manually express breast milk. Although many women may prefer to pump manually using machines, you can also express breast milk just using your hand. You might need to do this in case you don't have access to a machine, or if you're feeling very uncomfortable, or even if you just want to help your baby get started in a session by squeezing out a little bit of milk onto her lips. So in order to do this, first thing you have to do is clean your hands with soap and water. Then place your fingers and thumb like seen on the screen here, so that your thumb, your nipple, and your finger are in the same line. Make sure that your thumb and fingers are behind your areola and not on your nipple. For those of you who might not know, the nipple is the small button-like bud on your breast, and the areola is the dark circle all around it. So make sure that your fingers are well behind the areola. Then push towards yourself, that is like towards the chest wall, and then squeeze your fingers together, as you can see in the diagram. The first time you do this, absolutely nothing may happen and nothing may come out. But do not lose hope. Keep trying, and soon you'll find a few beads of colostrum in the tip of your breast. Now let's watch a video on how to hand express breast milk.
So let's talk about.
So as you can see, you hold your hand in a C shape.
Around the breast.
Place your fingers and your thumb on your breast.
The finger. Thumb and the finger.
So your nipple is in line with your thumb and your finger.
We're back farther. So there's a good inch between the.
Leave 1 inch gap from your areola and your finger.
Go straight in toward the
Push
chest.
inwards
So really
towards your
going
chest.
In. Okay, I'm not moving any part of the fingers. Straight back. So straight back into the chest, and then you're going to come.
And then squeeze your fingers together.
So back. Okay.
Then just keep repeating it by rotating your fingers around your nipple. Okay, sorry about that. Okay, so now let's look at the 10 steps to successful breastfeeding as issued by WHO or World Health Organization. This has been promoted by WHO. As you can see, the joint efforts of the healthcare organization, the parents of the baby, and their family is required to ensure that the baby is successfully breastfed. This is especially necessary in today's day and age, where the rise of nuclear families often means that a new mother doesn't have an older and experienced woman in her home to guide her with breastfeeding as well as taking care of the baby. Therefore, these women are often misled by information on the internet. A very common topic today is COVID-19, as we all know. You may be worried whether or not you can breastfeed your child if you're COVID positive or suspected, but do not worry. As per the current information that we have, there is nothing that suggests that COVID can be transmitted through breast milk. Therefore, the virus cannot be transmitted through breast milk. And WHO recommends that all mothers breastfeed their babies irrespective of their COVID status. In case the mother is COVID suspected or COVID positive, you can maintain basic hygiene measures in order to protect your child from the infection. You can do this by washing your hands before you start breastfeeding, wearing a mask, and disinfecting regularly used surfaces regularly. Medical considerations. Although, as we've seen, breastfeeding is considered the ideal form of nutrition for your child, there are several medical conditions that are contraindicated for breastfeeding. That is, they may harm your child. For example, if you're HIV positive, you should not breastfeed your child because HIV infection can be transmitted through breast milk. Other conditions include active untreated tuberculosis, being on chemotherapy for cancer treatment, undergoing radiation therapy, and so on. Furthermore, there are also certain drugs that can reach your baby through breast milk. Therefore, you should not breastfeed your baby if you are using any recreational drugs like marijuana or cocaine or even certain prescription medications. So be sure to always consult your doctor before starting a new medication. When babies receive such drugs through breast milk, it can cause irritability, sleepiness, poor feeding, growth problems, and lots of other issues. There are also some situations that may make it difficult for you to breastfeed. So this includes low breast milk supply due to underlying conditions like hypoplasia, which is a rare disorder of the breast, PCOS or polycystic ovary syndrome, which is a little more common, hypothyroidism, or breast surgery. With treatment, some of these issues can be resolved. However, some problems cannot be resolved, and in that case, the infant can be fed formula. Other challenges that you might face while breastfeeding include sore nipples in the beginning or dry and cracked nipples. If you have inverted nipples, that will also make it a little difficult. Breast engorgement, blocked ducts, breast infections, or just being stressed and worrying about not producing enough milk. This is a very common worry that a lot of new mothers have. They always think, am I giving enough milk to my child? You don't have to worry about this. A general rule of thumb is that if your infant is wetting more than 6 diapers a day, that means she's definitely getting enough milk. Your body needs the frequent, regular demand of your baby's nursing in order to keep producing the milk. Some women mistakenly think they can't breastfeed if they have small breasts, but this is a misconception. Small-breasted women can make milk just as well as large-breasted women. All you have to do is maintain good nutrition, plenty of rest, and stay hydrated. Another thing you should be prepared for while breastfeeding is your baby might bite on your nipples. This can be a pretty shocking and painful experience, but don't worry, it's quite common and there are many reasons behind it. For example, your baby may have sensitive gums because he is teething. He may be bored and trying to get your attention. He may be feeling unwell or feeling either overwhelmed by a fast flow of milk or frustrated with the slow flow. Luckily, this is usually just a passing phase, and there are several coping mechanisms that you can follow. One of them would be to avoid giving a dramatic reaction when your baby bites. When your baby bites and you feel the pain, you might be shocked and you might cry out and push your baby away by instinct. But do not do this because this might just upset them further. Instead, you should calmly remove your baby from your breast by inserting a finger into the corner of their mouth and tell them that it's wrong. In case your baby is teething, you can offer an alternative to chew on, like a teething toy. Now Cheryl will take it from here.
Yes. Thank you so much, Shweta. I'm now going to give you a few pointers about pacifiers and artificial nipples. So, what exactly are pacifiers? Pacifiers are types of artificial nipples which are usually used for unhappy babies. So, babies that are crying for a continuous period of time, parents usually use pacifiers to calm down their baby so that they become more comfortable. Okay, some parents stick to using pacifiers but don't even seek to understand what is actually bothering the baby. Suppose your baby is crying and the parent directly uses a pacifier without even bothering to understand what is the reason for your baby to cry. Can I just get a minute? I think the screen isn't being shared. Please give us a minute here. All right, till we have this screen sharing back into place, I think I'm going to continue speaking about pacifiers and artificial nipples. So, as I said, pacifiers, healthcare professionals are going to advise you to not use a pacifier till your baby reaches 3 to 4 weeks of development after your birth, basically because of the fact that pacifiers alter the receptance to mother's nipples. Now, the shape of a pacifier is that of an ideal nipple, but each and every mother has a different nipple shape, a different nipple proportion. And so, if you introduce a pacifier to a baby at a very early stage, he or she might get its receptance, and then it's going to find harder to suck on milk from the mother's nipple. And so, as it will be given in the slide, healthcare professionals avoid the usage of health pacifiers from the time of delivery till about 3 to 4 weeks. Okay, so why were artificial nipples used initially? Artificial nipples are mainly used for women who deliver preterm. So, a premature delivery, a premature infant who is less than about 35 weeks. So, these females show to have flat or inverted nipples, and that's because of the fact that they've had a preterm delivery. So, there is nothing wrong with having flat or inverted nipples because artificial nipples are always an option for ladies who show such diagnosis. Okay, coming to the duration of feed of breast milk, there is a common term known as a cluster feed. So, what exactly is a cluster feed? There will be a few babies who will resort to feeding continuously with just short interval breaks and then stop feeding for the rest of the day or just go off to sleep for the rest of the day. But there will be a class of babies who will feed on demand. That is, for example, feed 8 to 12 times in 24 hours. So the first group of babies who resort to, feeding onto mother's milk at very short intervals and then stopping for the rest of the day. There is absolutely no distinguishing factor between either of the classes of babies. Everything is fine. It all depends on the baby. And all that you as a mother have to confirm is that your baby is satisfied after each feed. That is it. I think we're going to be screen sharing. Yes. Okay, I think screen sharing is going to take a few more minutes. So by the time the screen sharing takes place, Let me come to a few advantages that breast milk would have for the baby. There are uncountable advantages that breast milk have for the baby, and that is the prime reason why breastfeeding awareness all over the world is brought into so much of highlight, and it needs so much of importance. All right. So breastfeeding has shown to reduce chances of infections in the baby. Chances of ear, respiratory tract, and urinary tract infections have shown to be lesser in babies who are breastfed rather than mothers who use infant formulas for their babies. Apart from that, breast milk forms the most ideal nutrition for the baby. You need not worry about the constituents of breast milk at any point of time. Breast milk contains the exact quantities and the exact quantities that are required for your baby's healthy development and for a healthy life in the future. So even if you are a preterm baby, your breast milk is ideal for uh, even if you're suppose a pre-term delivery, you've had a preterm delivery, your breast milk is still ideal for your preterm baby. That's because the infusion of the constituents in your milk and the development of your baby go on hand in hand. They happen simultaneously. So you need not worry if you have delivered your baby preterm, your breast milk is still ideal. As I said, fewer chances of infection. Babies also show to have lesser vitamin deficiencies. So breast milk has all the vitamins that are required for your baby except for just one vitamin, that is vitamin D, which is present in lesser quantities in breast milk. So your doctor or your gynecologist would have definitely advised you to take external doses of vitamin D, which is absolutely fine. Apart from vitamin D, I think apart from vitamin D, I think every possible vitamin is present in the breast milk and forms the ideal nutrition for babies. Okay. Fewer healthcare visits. Research has also shown that, give me 1 second. All right, I think I'm going to continue by the time the technological issues fall into place. All right. So breast milk has shown to possess a few chemicals that have proven to lead to lesser future obesity in the children by about 4%. So breast milk contains a few bacteria which are also called as the good bacteria. So we as mature humans, we have a few good bacteria in our system which helps to metabolize fat, which helps to deposit fat in the proper places that it should be in the body. It helps to excrete fat because your body knows how the amount of fat that is required for yourself. But immature babies or babies that have just been delivered do not have a mature system. And so breast milk provides you the good bacteria which is going to help in proper deposition of fat. So there are fewer healthcare visits, fewer hospitalization episodes, and hence in general a lower medical expenditure is seen for babies who are breastfed rather than using infant milk formula. Okay. Next point, breast milk contains proteins called as whey proteins. Now, whey proteins make the breast milk very, very easy to digest, which is a very good thing for the immature system of the baby. Breast milk also contains a chemical known as the polyunsaturated fatty acid. And polyunsaturated fatty acid is the substance which also, along with a few more chemicals, it helps in proper brain growth. And no doubt, research also shows that children who are breastfed in early stages of life possess to have a higher intelligence quotient and an even higher emotional intelligence quotient as compared to people who are not breastfed as for the ideal period. Atherosclerosis in late life is again prevented because of breastfeeding. Okay, what is atherosclerosis? So atherosclerosis basically refers to a condition wherein the cholesterol which is in your body gets deposited in the arteries and veins of your body, and hence there is clogging of the arteries and veins, and hence the blood flow to essential supplementation of organs is stopped. So there are a lot of important organs that need a continuous flow of blood, and if there is a cholesterol deposition in the artery or veins that substitute for that organ, that leads to atherosclerosis. The condition is called atherosclerosis, which in the future, suppose for example at the age of 50 to 60, there are increased chances of cardiac heart failure or heart attacks, and all of this is basically because of having an atherosclerotic artery or a vein. Now, according to research, researchers have shown to us that atherosclerosis in late life, the chances of a breastfed baby having atherosclerosis is way lesser than the baby who is fed an infant formula. Next up, breast milk also has the perfect proportion of calcium is to phosphorus. The ratio of calcium is to phosphorus is just absolutely perfect for the baby, for proper bone development, for proper strength and bone growth. Okay, as I said, comparatively higher scores of intelligence quotients and decreased risk of chronic diseases. So this is a very important point. Many of you would have heard of children having diabetes, and scientifically this is called as juvenile diabetes. Many of you may have also heard children having cancers of the lymphatic system. This is scientifically called as Hodgkin's lymphoma. And there is also another term which is called as sudden infant death syndrome. Okay, so in this syndrome, there are babies less than 1 year of age who end up dying, which is a very unfortunate incident. But the main reason for this to happen is because, like, if we take our example, we are fully grown and mature, our systems function to perfection. So, for example, if you just take a walk on the staircase or a jog in your park, within a few minutes, you start having shorter and faster breaths. Mainly because of the fact that your body has realized that the oxygen capacity has decreased and you have to make up for the oxygen loss in your body, and so you take shorter and faster breaths. But in the immaturely developed system of a newborn infant, the baby is not able to understand or to feel that the oxygen levels in its body has reduced. So what usually happens is that suppose a baby is sleeping on its stomach side, and it has its head embedded into pillows or cushions or bed sheets somewhere around the bed. So it does not understand that it is inhaling the carbon dioxide that it just exhaled. So there is lesser, arousal property in babies because of an immaturely developed system. So breast milk has shown to avoid chances of sudden infant death syndrome because it leads to the faster development of a more mature system. Sudden infant death syndrome is not only because of the immature bodies of the babies. There are a lot more causes such as pregnant women who are engrossed with smoking, or even inhalation of passive smoke have all shown to cause sudden infant death syndrome. So yes, advantages for the baby. There is a higher margin of the baby to not receive chronic diseases. Okay, is the screen share ready? All right. Advantages for the mother. As there are so many advantages for the child, there are also an equal number of advantages for the mother. Reduced uterine bleeding. So the baby is stuck on the nipple, and the area around the nipple, the darkened area around the nipple is called as the areola. And when the areola is stimulated, there is this hormone called as oxytocin, which increases in your body, which fluctuates, and it spreads in the blood of your body. Now, oxytocin is a hormone which is also called as the anti-stress hormone. It's also called as the love hormone. So oxytocin is the one which causes your uterine contractions, and because of the increased levels of oxytocin, it's also going to reduce your uterine bleeding soon after delivery. Zero risk of pregnancy up to prevalence of no menstruation. Now, generally, researchers have said that women do not menstruate for about 6 to 12 months after their delivery. But a few Indian women, a handful of them, have also shown to have started menstruating just within 1 to 2 months of delivery. That's absolutely normal. Do not consider your period to be a sign that your breastfeeding has come to an end. Both of these aspects are not related at all. Getting your period and breastfeeding, they are not related at all. Your baby might just be a little fussy, during your those days of your month, because you might just experience spotting and irregular periods because of all the fluctuating hormones in your body. But you do not have to worry, and you do not have to feel that your breast milk is not good enough for your baby, or your breast milk has gone bad. All of these are just myths. Your breast milk is just as nutritious and suitable for your baby as it is when you aren't menstruating. It's just the same. The only fact, the only notification of you beginning to menstruating all over again just tells you that you are fertile once again. That is, you can carry another baby, you can become pregnant once again. That is the only indication of beginning to have menstruated. Helps in contraction of the uterus. Again, as I said, oxytocin is a very, very important hormone which keeps all of these functions regulated, and also helps in contraction of the uterus back to its size before pregnancy. Prevention of an earlier return to pre-pregnancy weight. Now, breastfeeding moms tend to lose more weight than mothers who do not breastfeed. Now, the thing about weight loss is that all mothers tend to want to have a faster weight loss, but healthcare professionals would not want you to lose weight at a very rapid pace. Your weight loss has to happen in association with the change of hormones in your body. Okay, so breastfeeding will help you lose weight, but breastfeeding will also help the regulation of your weight loss, so that there are no, side effects for other systems of your body, so that your weight loss is properly coordinated with the changing hormone levels of the body. So yes, those are the advantages for the mother. All right. Elimination of postpartum depression. This is a very, very important topic. In fact, now that you're suppose a pregnant woman, you're going to give birth, and all the new moms, you have to cope with a lot of new things during this period, a lot of new activities. You're going to have sleepless nights. You're going to have so many episodes of nappy changing during the day. Apart from that, you're going to have so many hormones within your own body that are altering. You're going to have back pain and uterus pain and stomach pain and so many more things. Apart from that, your family and friends were just giving you so much of attention. They were treating you like a queen when you were pregnant, but now that you've delivered, all the attention, shifts to the baby. So this might just lead to a few unwanted tears. You might feel low. You might also have these feelings of self-doubt, because this is the period when you are going to want to be the best mother, the most perfect mother for your baby, without leaving any, place closed. So you want to be the best, and so this is a very important period. During this period, if you have symptoms of depression, and if this is not notificated, and if this continues, this can lead to a bigger problem called as postpartum depression. So what you basically should do on a daily basis, on regular intervals, is catch up on your sleep. All of those sleepless nights, I really feel you should catch them up by the weekend or whenever you get time. Next up, self-pampering. You need to self-pamper. You need to love yourself. You need to love for yourself so that you can love your surroundings and your baby equally. Next point is be positive. You need to have an optimistic approach towards everything, because now you are responsible. You are a responsibility, plus your baby is your responsibility. Okay, you have a family to take care of. You also have this new beautiful thing in your hands, and so you have to really be positive, and your outlook has to be very positive. And lastly, do not compare. You mothers should not compare yourself to other mothers, and do not also compare your children to other children, especially during these periods of time, because of the fluctuating levels of hormones in your body. So, breastfeeding is also shown to decrease the risk of anemia during your menopausal stages. It has also reduced the risk of premenopausal breast and ovarian cancer. And as I said, oxytocin is also known as the love hormone. So it attaches you with the baby and vice versa, the baby with you. So there's the formation of a bond between you and your baby, basically because of this biological hormone which is called as oxytocin. Okay. Moving on to the social stigma related to breastfeeding. Well, India has no legal statute or any legal law which deals with breastfeeding, but there is no ban on women who breastfeed in public. But usually people, especially women, do not prefer to breastfeed in public, mainly because of the actual or potential objections that they might feel, or the fear of people telling them something, a few negative comments coming their way, or a few harassments. So Indian women usually do not breastfeed in a public space. They prefer a closed space. They prefer they might just take a friend or her mother or somebody who's close to her with her to breastfeed. Now this has to be normalized, and that's the reason breastfeeding awareness is so important, because we need to make people realize how beautiful and how phenomenal a mechanism breastfeeding is, how naturally beautiful females are blessed with. So yes, breastfeeding is not a crime. You do not even have to be shy about breastfeeding. So yes, Indian women, I just hope in the later stages of time get more comfortable and get more confident about they themselves being a woman and be proud of breastfeeding. So the Indian Milk Substitute Feeding Bottles and Food Act, which was amended in 2003. So what this act basically does, it regulates the production, supply and distribution of infant milk substitutes with a view to the protection and promotion of breastfeeding. It basically puts a standstill to the milk substitutes and it encourages breastfeeding. Okay. Just the last few pointers. Practice rooming in. What is rooming in exactly? Rooming in is a practice which allows mothers and their babies to stay together day in and day out for a maximum amount of time, so that there is a bond that is established between a mother and her child. The child has to have a certain level of trust to suck on your breast, and you also should have a certain level of emotion towards your baby to do that with love and to do that with a sense of satisfaction. So researchers have proved that grooming in, that is keeping the mother and baby together just after delivery, has proved to have really effective results of breastfeeding. Refer mothers to breastfeeding support groups after discharge from the hospital. So what are breastfeeding support groups? They are basically pages on Facebook, and there are a lot of on-field groups as well. So what they do is they connect a mother to a mother, a child to a child, and in fact an entire family to an entire family who just had a newborn in their household, to share their thoughts, to share their experiences, or suppose ask doubts and get things cleared, and share anything new that they've seen throughout their parenthood. So they are basically families who like to grow together with as friends and families. So yeah, they're a peer-to-peer support group for breastfeeding parents, their partners and family members. So any of you can definitely contact breastfeeding support groups for maximal benefit. Normalize breastfeeding publicly or create a safe space. As I said, this is a beautiful phenomenon, and it shouldn't be faced by the social stigma that it has been faced with since so many years. I think normalizing breastfeeding and giving it the importance that it actually deserves and respecting the entire phenomenon is a big value. Do not get influenced by the baby food industry. Now, the baby food industry might sometimes, try to have an impact on people, saying that it has a better quality of milk as compared to breast milk. They might, end up promoting their brand, saying that, the constituents or the additions, the vitamins, there are so many more things in breast milk, the antibodies, immunoglobulins, they are all, we can give it through our brand. you do not have to get influenced by that. There is no research that has till date proven any milk substitute brand to have overcome the benefits of actual mother's breast milk. So do not get influenced by that at all, and always promote breastfeeding. Last point, formula feed. Now that we've spoken so much about breastfeeding, there will be a few instances wherein a handful set of ladies will not be able to breastfeed. They may be diagnosed with a few problems that's related to their breast, and this might lead to inefficiency in breastfeeding. This is definitely not a problem. So for the amount of for the amount of awareness that breastfeeding has to be given, I would also say that formula feed is also a very good option. It's also extremely good option, although it's just not the best. So there's a really little margin between the positive effects of breast milk and the positive effects of milk substitute. There's a really little margin, especially for mothers in conditions such as breast abscess or having cracked bleeding nipples. So breast abscess basically there's a collection of pus somewhere in your breast, somewhere near your nipple, and that's basically because of bacterial infection. So your doctor is definitely going to advise you to not breastfeed your child because of transmission of the bacteria from your breast to the child. So mothers in this situation, you are going to have to resort to formula feed, and please do it confidently because it is also the very best option and you are doing it for the best of your child. Also, cracked bleeding nipples. Female might have cracked nipples because of the excess engorgement of milk in the breast, and the breast has to carry a lot of weight to supply nutrients to the baby, and so you may have seen cracking in your nipples. So healthcare professionals are going to advise you to still continue breastfeeding to your nipple because that is going to help your cracks close down. Okay, so if you have cracked nipples, you should still continue breastfeeding because, or if they are at a very severe level, you can also use lanolin creams or oil cream, but you should continue breastfeeding. Now, suppose you have bleeding along with cracked nipples, you should then resort to formula feed because, of course, if you have cracked nipples along with bleeding, you shouldn't breastfeed. You should stick on to formula feed.
Hello, am I audible?
Yeah, Shweta, you are.
Okay. Can you see my screen?
Give me a moment. It's screen sharing is active. Yes, I can.
Okay. Okay, so sorry about the technical difficulties before, but let's start with the myth-busting session that I promised at the end of this session. So here we'll be talking about some common myths and misconceptions that many people have about breastfeeding, and we'll give you the actual scientific facts. There is a very common myth that traditionally a baby should be given honey or sugar or jaggery water before the first breastfeeding session. This is usually done in order to welcome her to the world. However, this is completely unnecessary, and these prelacteal feeds are actually not recommended. The baby doesn't need anything but breast milk for the first 6 months.
Okay, so there is a myth which states that it's normal for breastfeeding to hurt. The actual facts state that while initiating breastfeeding for the first few days, your breast might feel to be tender and uncomfortable. This discomfort should not last for more than a few days. So consistent pain may be caused by improper latching or infectious case.
Okay, the next myth that we're going to talk about is usually people say that you should only eat bland food while breastfeeding. They have some ideas that if you eat too spicy food or too sweet food, this will be transmitted to your baby through your breast milk. However, this is completely false. The fact is you can eat whatever you want. The only kinds of food you should be avoiding is food that may cause allergy, like soy or peanuts.
All right. The next myth states that you should stop breastfeeding if you're sick, and the fact would state that it depends on the illness. You can breastfeed your baby if you have a mild cold or a mild flu or other common illnesses. In fact, even if you have diabetes, there is absolutely no problem in breastfeeding your child. Just be careful to wash your hands and avoid coughing and sneezing near your baby.
Next, there's a common misconception that you need to breastfeed your baby every 2 hours and keep your breastfeeding on a schedule in order to keep her hunger in check. As I mentioned before, this is completely unnecessary. In fact, you should practice demand feeding, which is you feed your baby only when she shows signs of hunger.
The next myth says that you're a bad mom if you don't breastfeed, and that is absolutely wrong. The actual fact says that some women are unable to breastfeed because of a lot of issues. There could be various reasons for a woman not being able to breastfeed. Supplementing breast milk with formula or relying entirely on formula does not make you a bad mother at all. The most important thing is giving your baby all the nutrients and love that it deserves and all the love that you can for your baby.
We've now come to the end of our session. These are some additional resources that you may view. We have webinars given by prominent health professionals that will teach you all about breastfeeding. We'll be sending these links on the WhatsApp group so you can view them. And now we'll have a short Q&A session wherein you can enter your questions in the chat box and we will reply.
All right, so let's start with the Q&A session. We've had a few questions already in the chat box, and the first question says that can a mother with chickenpox feed her baby, and can she give breast milk while taking acyclovir? Okay, so mothers who contract chickenpox are also allowed to give breast milk to their baby, but the only precaution that you have to take is if you have a few, vesicles or a few pustules around your breast area, that has to be covered. That shouldn't directly touch your baby to protect the baby from transmission of the organisms from the vesicle to your baby. So basically, yes, mothers who contract chickenpox can breastfeed as any other normal mother. Even the ones on acyclovir can breastfeed normally because such drugs, there's a very small amount of it that passes to the baby through breast milk because there are a lot of barriers, there are a lot of filters before the breast actually reaches the baby, and drugs usually are not able to cross such barriers. Still, you must consult your gynec once before doing that because it all depends on the dosage that you're intaking. If you have a high dose intake, then it might pass through the filters. It might pass into the breast milk. So it definitely depends on the dosage. So you should take a proper consultation from your gynecologist.
Okay, the next question that I'll answer that question, Cheryl. So someone had asked, how should a mother take care of her breast during the feeding period? The most important thing is to practice good hygiene. So keep washing your hands every time before you feed and also clean your nipples after every feed. Another important step you can take is by wearing breathable bras that are not too tight. You can also moisturize your nipple with your breast milk itself. And in case you're feeling any sort of breast engorgement, you should always get that checked. Make sure that your child is latching correctly onto your nipple. This is very important because if your child is latching incorrectly, it may cause cracked or bleeding nipples. And always remove your child from your breast correctly at the end of the breastfeeding session.
Okay, so there's another question which says, how to take care of the breast during and after feeding the baby, and any lotions to avoid infection. So, as Shweta just mentioned, all of the precautions that should be taken to maintain good hygiene, so, for example, washing hands and everything that she said, the answer really relates to the previous question. But as I said, even during presentation, that in case you have cracked nipples or bleeding nipples, you should resort to creams such as lanolin or any kind of oil cream if you have cracked nipples. For lotions, you shouldn't self-prescribe yourself. You need to see what works the best for you at that point in time. What is important is to take care of the nipples before feeding. You have to clean it well before feeding. So that's what is the most important. Okay, let's wait for few more questions.
Okay, someone has asked what are the reasons why some mothers secrete less milk. So as I had covered this in my presentation, often women worry a lot thinking that they are secreting less milk. But the way to know that you're secreting enough milk is to check how many diapers your baby is using in a day. If it is using any more than, that is, he is wetting any more than 6 diapers a day, that means you're secreting enough breast milk. However, there are some mothers who are genuinely unable to secrete enough breast milk. This can be due to various reasons. There is something called hypoplasia of the breast. So this is a pretty rare condition in which the breast has insufficient glandular tissue. In these situations, there may be low breast milk supply. Some other conditions include PCOS, which is polycystic ovary syndrome, or hypothyroidism, or if you've had any sort of breast reduction surgery or mastectomy, then even there the milk supply will be a little reduced. There is a misconception that women with small breasts will have less milk supply, but this is not true.
Shalmali has a doubt, she says, and just want to unmute her so that she can ask her doubt.
Yeah. Yes.
Yes, Shalmali, go ahead.
A small boil is developed near my nipples, whether it is causing any serious problem or not.
Sorry, the voice. Sorry, can you please repeat the question?
I'm pregnant for the first time and it's 7th month. And a small boil is developed near my nipples. Is there any severe problem or not? I want to clear.
Shalmali, I think it really depends on finding out the cause of the boil. It may just be a heat boil, or it could also be a sign or a symptom of any other further complication. The boil has to be examined, and only then can we actually, make a diagnosis of why did you have the boil. I really think you should visit your healthcare specialist because before delivery at least, and do not wait for any more time because a boil in the breast should not be taken easily at all. For now, you should really take care of your hygiene because it may just be a heat boil also. But yes, I would strictly advise you to visit your healthcare doctor.
Okay, thank you, ma'am.
Okay,
Are
there's
there any?
another question.
Okay.
Yes, Shweta. Okay, there's a question which says if you don't feed regularly, you won't produce enough milk. So it's all because of poor latching technique. So as Shweta explained to you, the proper position of holding the baby, proper latching technique, there are chances of your breast not forming enough milk, but usually you may just feel that your baby isn't intaking enough milk, but that may be just because of poor latching technique. There are also chances of low oxytocin production. As I said earlier, that there's a really variable degree of all of these hormones going in this huge circle into your body. All of them are fluctuating because they have to adjust to you, to your baby, and after parturition, after delivery, again they have to adjust to you as an individual person alone. So there may be a few periods of time when you have low oxytocin production, maybe because of which your breast is not able to produce enough milk, and the cycle will continue. Your hormones are uh, apt to regulate themselves according to your body's needs.
Okay, someone has asked, can you tell us about milk storage? So nowadays you see these machine pumps which you can use to express milk and you can store that milk. So generally, you can store it in the refrigerator up to a few days, I think around 4 days. And if you're not going to store it in a refrigerator, and if you're going to keep it at room temperature, then you can have it only for a few hours. And you can always deep freeze it, which it will last for much longer.
Alright, are there any more questions?
Okay, any more questions? We can wait for just one last question before we wrap up the session.
Okay, so this shall be the last question. Someone has asked, weaning is as important as feeding. What is the ideal age? Okay, so health authorities recommend that you should exclusively breastfeed your child up till 6 months. After 6 months, you can start introducing complementary food and you can continue to breastfeed your child up till 2 years. This is the most optimum amount of time. And after 2 years, then you can stop breastfeeding your child. So during this period from 6 months to 2 years, the frequency of your breastfeeding will gradually reduce. But you should try to carry on breastfeeding for as long as the baby and the mother both desire it. One important point to be noted is that you shouldn't suddenly stop breastfeeding your child. Instead, you should gradually decrease the frequency and slowly wean your baby. It really depends on the mother's and the baby's preference.
Okay, thank you very much, Shweta and Cheryl, for sharing your valuable time with us and giving us such an interactive and useful session. And I would really appreciate if you could shoot a very short video of less than a minute and tell us about your breastfeeding experience. This is for all the newly become moms, so that you can also inspire the others like you, and also gain additional learnings from the sessions on your thoughts that you have changed by attending this session. We'd love if you could share that with us with a small video. I'll be sharing a link or an email ID where you can share your videos. Please do it by tomorrow itself. And also I'll be sharing a link for feedback. So I really appreciate if you all can share your feedback with us. Thank you very much, Cheryl and Shweta, and thank you very much to all the participants who attended this meeting. You've been a great audience. Thank you.